Hello and welcome everyone to the Nutrition Sensitive Interventions webinar. Thank you all for your presence today with us. I wanted to first present Danka Panchova, who is our GNC help desk for integration, who joined us a month ago, and I will let her present herself in just a minute. And I'm Yara Sfer. I'm the Global Nutrition Cluster Technical Help Desk that some of you know me. So basically my work with the Global Nutrition Cluster is to support country teams and country clusters in every question they have in technical question they have in nutrition in emergencies. So it can be around IYCFE or acute malnutrition management, or it can be around needs assessment and analysis, or any other technical question in nutrition in emergency that you might have. And in case I don't have the answer, I am here to link you as well with the global experts that are out there. So that's for me. And I want to let Danka present herself as well. Danka? Are you there? Danka, can you hear me? Hello? Oh, okay. Can you all hear me? Are we having some audio issues here? Can you hear me?
Yes,
we
can hear you.
Okay, thank you very much. Okay, I think Danka might have had a problem with the connection, so she might try to join again. So what I can do, Danka, are you there? I just saw you got back in. Okay, so maybe I can present Danka a little bit, and then we can continue. When Danka is back with us, she can speak. So Danka has been with us as a Global Nutrition Cluster Integration Help Desk since a month now. So basically she's here to support cluster coordinators, technical working group chairs, and all country cluster teams in integration. But she's here also integration with other sectors, but she's here also to support the integration of nutrition with the other sectors. So she works with all the sectors. Sorry, I think she would have done a better job presenting herself, but I tried my best. So basically Danka and I are going to go through this webinar on nutrition sensitive interventions, and after our presentation, we would like to discuss with all of you. So how is it in your country? So we will try to spare some time for discussion at the end. So here we go. First of all, what are we going to talk about today? So after the welcome to all of you and the introductions of Danka and myself, I want to go through what are the nutrition-specific and nutrition-specific sensitive interventions. What are they? So we'll go more in details and a little bit about the history as well. And Danka will give you more in-country tips to improve intercluster integration, and she will also present some of the global initiatives that are taking place to improve intercluster integration. And as I said at the end, we will have a discussion, so all of you can also share your experiences, and this will all enrich the discussion, as all of what you are experiencing is very valuable and will help all of us improve the integration. Okay, so let's start. So what are the nutrition specific and the nutrition sensitive interventions? Where do these terms come from? So there is the peer-reviewed journal called The Lancet that had published literature reviews, a first series that was published in 2008 called The Maternal and Child Undernutrition. And in that first series, the researchers did the literature review for a number of studies in maternal and child undernutrition, and they came with some conclusions. And some of the conclusions were, some of them you all know about them, which is to need to focus on the crucial period from conception to a child's second birthday, the 1,000 days, to give greater priority to national nutrition programs. They also spoke about the importance of stronger integration with health program and enhanced intersectoral approaches. And they spoke about an importance to focus on coordination in global nutrition system. The global nutrition system in terms of the international agencies, the donors, the academia, the civil society and the private sector. All of this system, there needs to be more focus and more coordination in it. But maybe where the term was coined, nutrition-specific and nutrition-sensitive intervention, was rather in the second series that was done 5 years later. So the Lancet published a second series, a number of papers that were also a literature review on the topic of maternal and child nutrition. And in this second series, which was out in 2013, a number of papers also discussed not only the fact that there's a need for integration, but also it examined what is the evidence supporting specific nutrition interventions and also nutrition sensitive interventions. But before I tell you what are the conclusions, maybe I would need to dive in to what are those nutrition specific and nutrition sensitive interventions. So you are all aware of the UNICEF framework, causal framework for undernutrition. So in the UNICEF framework, it shows the underlying causes of undernutrition, and then it shows the immediate causes, etc. The Lancet series, the 2013 series, they reviewed this framework and they went a bit further. So they called it the framework for actions to achieve optimal fetal and child nutrition and development. And in this framework, you can see that they show in blue what are the immediate causes of child undernutrition in blue, and then in the left-hand side you can see a series of actions and interventions that are evidence-based, or at least most of them, that are evidence-based that actually can address those causes. So these are what we call in blue. These are what we call the nutrition-specific intervention, and this term was coined by the researchers in the Lancet. Then they showed what are the underlying causes of undernutrition, and to the right-hand side you can see nutrition-sensitive programs and approaches, and those are a list of programs and approaches that can actually be put in place as an action to address those causes. What you also see below in pink is the enabling, is more like not the underlying causes, but even further, whatever is in relation to the politics and governance, the leadership capacity and financial resources, which are more like the causes that are very much in line with the environment. And then to the right-hand side, there are some actions that can be put in place to build this enabling environment. Okay. I wanted to go a little bit further in details here. So the Lancet defines nutrition-specific intervention as interventions or programs that address the immediate determinants of fetal and child nutrition and development, adequate food and nutrition intake, feeding, caregiving and parenting practices, and low burden on infectious diseases. And it lists some of the nutrition-specific interventions are listed here. So, for example, maternal dietary micronutrient supplementation, promotion of optimal breastfeeding, complementary feeding and responding feeding practices and stimulation, dietary supplementation, treatment of severe acute malnutrition, disease prevention and management, nutrition in emergencies, etc. I also missed a few, I think. But so these are the nutrition-specific intervention as coined by the Lancet. They are intervention and programs that address the immediate determinants of fetal and child nutrition and development. As for the nutrition-sensitive interventions, here you are. The slide looks the same, but it's different. So the definition is that nutrition-sensitive interventions are interventions that address the underlying determinants of fetal and child nutrition and development. So food security, adequate caregiving resources at the maternal, household, and community level, and access to health services and a safe and hygienic environment. And not only those interventions and programs address the underlying determinants, they incorporate specific nutrition goals and actions, which is something that that I want to discuss a bit more about, because the intervention programs that address underlying determinants can be quite broad. For example, here we list agriculture or food security, early child development, women's empowerment. This is quite broad. So one way is to make sure that there's a nutrition lens in the goal of the program, to incorporate specific nutrition goals and actions so that this nutrition sensitive intervention is really sensitive, and does help improve the nutrition status of the population. They also explain here that nutrition-sensitive programs can also serve as delivery platform for nutrition-specific interventions. So, for example, if in agriculture and food security, for example, if there's one program that is the distribution of a food basket, which is a food security program, in this program, we can take the opportunity to identify and counsel pregnant and lactating women to do a triage, for example, on who needs further care or further attention, further counseling. So this could be a way that that a nutrition sensitive intervention that is addressing underlying determinants is also a platform for a nutrition specific intervention. Okay. There. This is just presenting some of the theory behind all this, and I'll be sharing, of course, the slide with you later. And some of the theory. So in the Lancet series, then they give us some tips at the end on how to enhance the nutrition sensitivity of those interventions and those programs that they listed. Which are agriculture and food safety, schooling, etc. How to improve the nutrition sensitivity is one, to improve the goal of the program. So initially, when we do the design of an agriculture program, or initially when we do the design of food security program, there needs to be the nutrition lens taken into account. So in a way to improve the targeting, the timing, duration of exposure to interventions with a nutrition lens in mind. There's also another important point which we discussed, is to use those programs as delivery platform for health and nutrition services. So this can also be at the onset or at the design of the program. This can be thought through, but it can also be done on the way, so as the program is being implemented. Another point that they put forward in the Lancet and is about women empowerment. So a lot of studies show that the more women are empowered, and the more the status of the nutrition status of children is improved. So they actually give recommendation to try to optimize women's nutrition, women's time, physical and mental health, and to empower women so that this actually reflects positively on the family. Okay, so this was just a presentation of the what we call the theory behind nutrition sensitive and nutrition specific interventions, but also what are the enabling environment interventions. But we didn't go into that, because this webinar is about nutrition sensitive interventions. And from here, I want to let Danka continue. And I just want to check first if Danka's mic is working. Danka?
Yes, thank you, Yara. Can you hear me?
Yes, we can.
Cool. Yes, I'm going to take the control of the presentation so I can continue. Just 2 seconds. Hello, everyone. So thank you, Yara, for presenting me, because why we came back again to the beginning? Because, well, I think I was having a kind of technical issues. Yeah, so I will just, sorry, I don't know, I will just come back to the last slide of Yara and continue from here. Although the theory and what has been recommended by Lancet seems quite logic, for the moment the nutrition sensitive still struggle, you know, from experience, struggle to take some more precise shape, because for more the recommendation of Lancet, they brought a lot of questions that might be very pragmatic, like for example, how we are sure that by doing nutrition sensitive, this contributes to the nutrition status, or what's the effectiveness of the nutrition sensitive, knowing that today nutrition sensitive might come from any field of life, and it might be quite specific to the context, to the specific needs of the population. Also, in the Lancet frame, the nutrition sensitive intervention were not specified. There was, for example, agriculture, which is a big domain. So what exactly in agriculture can be nutrition sensitive, or social safety net, or these are large domain of life that might be different activities. There was also a question of what's the shape of nutrition sensitive when we come to acute emergencies. Sometimes to put in place agricultural, like nutrition sensitive agriculture in emergency is quite difficult, or there's the big constraint to put in place such kind of activities. And I think very much from very pragmatical and process point of view, how we can make the other sectors to do in a way that the activities are nutrition sensitive while they have their own priorities. So this was just an illustration that from this side of the framework, when we talk about nutrition sensitive, we can talk about maternal mental health, but we can talk also woman empowerment, which is a large domain also that can take many forms. So this brings us to the conclusion that in fact there's no one size fits all, but if there's one thing that we as a nutrition sector can do to implement nutrition sensitive intervention is to work with the other sectors. So here it's absolutely clear that only nutrition sector will not be able, for example, to bring all to bring a comprehensive response, for example, to prevent undernutrition or to reinforce impact of treatment activities if we don't bring if the other sector doesn't help us. So for do that, some few principles here I put, but of course this is not an exhaustive list, and you can bring some of your ideas at the end of the webinar with some of your experiences and tips. But well, I put here just 6 because it's more beautiful on a slide. So we have coordination, coherence, and synergies with other sectors, and for better integration. Here, small also detail on the fact that integration might have different levels, and it doesn't mean necessarily to integrate for the sake of integration, but it has to be adapted to the context. It's important to, if we want to have a success working with nutrition sensitive and working with in an integrated manner with the other sectors, it's important also to bring the perceptions of the communities, because these are the people who will utilize the services after. Well, I'm not sure that I'm providing you something new, but the good idea is, as Yara said, is to bring, to always holistically mix nutrition-specific and nutrition-sensitive intervention. This might be like common platform, like in fact we do in the practice today. CMAM treatment, for example, CMAM is always implemented through health services in the majority of the context. So what if, while bringing CMAM treatment, we do also something more to help health sector to improve the quality of their services. So it's important to always keep in mind this lens. Of course, we never implement these activities like on a extremely, well, let's say that we can have some very acute emergencies, but there's always something before. So the importance of knowing that undernutrition is also sometimes brought by very basic factors. It's important to keep this existing system, even they are absolutely disrupted, alive, and to support them while responding to emergencies. We know also that there's a lot of factors that might be based in due to this enabling environment, and sometimes combining advocacy activity in the program can greatly help to influence on some strategies, policies, build local capacities. So these are important points of what can be done if we want to do nutrition sensitive intervention. And of course, while doing analysis, for example, now many, like all the clusters are in the very active joint analysis period for the HNO. It would be good to screen plan activities to some of the principles, for example, the protection sector on everything is gender. Check, for example, what the other are planning. So this has screen it towards the no harm principles. Because, for example, today everyone wants to do cash, but what about if food security sector is doing cash by targeting undernourished population and mainly families with kids, but maybe this might also have some inverse impact. So that's important that these activities are screened in the joint analysis, for example. You will also, well, often I'm with the cluster since 1 month, but I noticed that the people somehow have everyone, when we say intercluster integration, the people have different idea in mind. And the real, while I just wanted to provide this message here, in fact, we do in our everyday activities, we do integration amongst clusters. Maybe the levels are different. So I put here, for example, different activities that you do in your daily life, and that are activities of demonstrating an integration among sectors. And as I said, it might be a different level according to the context, according to the needs, according to the political environment. So the idea is to do as much as possible to integrate, because we believe that this can bring some more quality, more impact of the response. So, for example, now you all struggle with agreeing on common indicator for the joint analysis. And this is where you have to work with the other sectors. But I think this is also a great opportunity to bring the idea of nutrition sensitive and convince them that if they slightly orient their activities on the target, for example, on the most nutritionally affected zone, or some other criteria, you can use this process to also put a little more nutrition sensitive content. So I will move ahead. I wanted to show you here an example from something that has been elaborated in Nigeria. It was, I think, in 2018 or 17. So we elaborated an integrated training package for nutrition outcomes, and this has been piloted in Ethiopia and Nigeria. And together with Josephine Ipe and Caroline Abla, who's consultant for this work, and then while they were doing the pilot in Nigeria, the Nigerian team has elaborated a kind of 8-step framework, saying like, well, if we do this, we can say that first, the role of each sector for nutrition sensitive programming might be a little more clear, and this might be a process that involves all the actors. So I'm going to go through very quickly, because I would like to have a little more time for discussions after, but the idea was to use the platform of the Intercluster Working Group, or whatever it's called in your countries, the one who is led by OCHA, to first bring, to begin this process of joint analysis. And this might be a good opportunity, the HNO process that you are all in at that moment. And of course, we know that this requires that every sector bring their indicators, their data, and for the joint analysis. But then the nutrition sector can present and can take all this data, put them into the UNICEF conceptual framework for malnutrition, and then try to identify the different linkages that can exist between the different risk factors, how different indicator influence nutritional status, because and just to plot it on the conceptual framework, thus identify some gaps of data, and based on this analysis, nutrition sector can call now all the concerned sector for a meeting, so they can refine the analysis on the conceptual framework. Then once this is done, all the specific sector information can be updated, and then have a kind of good causal under nutritional tree, and use this tree to unpack then into intervention. It's like with the old details on some 5 W's frame can be done on this. So the idea is to facilitate all the factors that can influence, to facilitate, all the actions that can be taken for to comprehensively have a real nutrition response that can logically and holistically bring to some improvement on nutritional situation of the population, and also identify gaps, programmatic gaps. So after they put this next steps, well, you might read them from yourself, but roughly and wrapping up, the nutrition sector will come with the usual high impact nutrition intervention, while the other sector can also bring in this package of responses the specific sensitive action to address all the gaps to improve the nutrition outcomes. In this step 6 here, important thing is that while this is agreed between this group, all the sector have to make sure that they take this action and then reflect them in their sectorial plan, and then also try to identify some joint resource mobilization. For example, having an idea to write a joint proposal, some advocacy activities, or something else can be done around this. Afterwards, maybe the idea is also to have a specific step 7 specific response plan, and in which they have to agree on specific success indicators. The idea is not to have a very detailed success indicator, but just to make a choice of a few of them. And these success indicators might be followed by a specific platform that is formed by this smaller group that can have a regular meeting to monitor the implementation of this plan, but not mixing, probably depend probably on the context, but the idea of Nigeria was to not mix so much with the intercluster working group because they were thinking that the efficiency of the smaller group with the clear roles and responsibility might be more efficient if this go to comparing to a larger intercluster working group. I think this might be something that we can discuss also after, but I noticed that in some places the people believe that if we want to work together, this has to happen all the time under the intercluster working group, which in fact is not necessarily. So what we do now at global level to support nutrition sensitive but also integration between clusters. First, we have intercluster nutrition working group. It exists since 2012, but it has been like further reinforced in 2016 when the clusters met around the thematic of the 4 famines. Since the group has been quite reactivated and it has a specific work plan. So the Intercluster Nutrition Working Group have members from different organizations and from different sectors, although it's kind of overrepresented, I would say, with people coming from nutrition and food security sector. Currently, many people from health and WASH are also joining. Roughly, these are well, we have some people from protection also field. So there's an action plan. One of the items in the action plan were to have the integrated training package for nutrition outcomes that I spoke already. This package is available on the SharePoint, and then of course now we have capacity, me and some of the members of Intercluster Nutrition Working Group, to come to countries and to provide this training. The good thing of this in this training is that first we invite all the sectors. We want to have participants in all the sectors, and then on the 3rd day we take a whole day to set a joint plan. It might be following the methodology I just showed you before. It might be something else. There's different tools that can be used for this joint plan, but the idea is that this day generates this common efforts to work together actually. So that's the second thing. We have also a new small group that's absolutely unofficial, but the 4 clusters, the global food security, global WASH, global health, and global nutrition cluster coordinators are currently working together on a joint plan, and you will hear from this soon because there will be some communication coming to you with more details on this joint work, but here it is. This is happening. Well, in my task, I have the task to support countries to write case studies. So we believe that many activities and many experiences are ongoing, but they are not well advertised. They are not so much disseminated. So we believe that this has to happen, and then if we document a little more the learning, this might be also taken as example from the other countries. So of course, every country that wants to share a case study around integrated or nutrition sensitive response, please do not hesitate to contact me, and then I can support fully the process on the case studies. Well, the next is GINSI Help Desk, which, well, I'm here since 1 month, and normally the position of Integration Help Desk is there for 2 years. So we hope that this might, if we bring some good experiences, some good, if this bring show the need of continuing having such help desk, but it depends also on the work that we can do together, might be prolonged. And we have GTAM. Maybe Yara, you can say something around GTAM.
Yes, sure. So all of you have heard that there is the Global Technical Assistance Mechanism, which is a mechanism that's put in place, which is an initiative from the Global Nutrition Cluster and also UNICEF. It's co-led today by UNICEF and World Vision, and it's an initiative it's a mechanism to address all the technical questions that are coming from the countries and that are too complex or too complicated to be addressed at country or at regional level. And the idea of this mechanism is to put in place different platforms of experts at the global level, whether they are coming from countries or region or at the global level, but at least that there are a platform and there's a system that addresses those issues that are not that are continuously being again put on the table as an issue. Sorry, I'm not able to express myself properly, but then this mechanism right now has been able to advance and support the creation of some working groups at the global level. For example, the Nutrition Information System Working Group, but also other existing working groups like the Infant Feeding in Emergency Working Group has agreed to work with the Global Technical Assistance Mechanism, and also the Intercluster Nutrition Working Group has agreed, but yet to be further developed, agreed also to be a working group that addresses some technical questions from the field. So we have different working groups that are being formed, and there is a quarterly newsletter that we will be sharing with you in the next few weeks that shows the progress of the Global Technical Assistance Mechanism and what it has done in the last year, and where we are at in terms of being able to support countries in the different technical areas, including the intercluster or the nutrition sensitive interventions in emergencies.
Yes, thank you, Yara. Well, I think this is everything we wanted to tell you, and I just formulated a few questions here, very simple. We will be really happy to know a little more from you if some of your country can share some of their experiences from those who doesn't do what exactly the reasons and the bottlenecks that they have to face. I would like to know, like, if there's anything that we can bring and to facilitate, and what can be facilitated probably at global level, because this is where we can be also helpful, not only the support, but the most important is also the day-to-day support that we can provide. So I'm eager to know a little more what are your needs, what are your constraints, and how we can strengthen the joint work according to you. So please do not hesitate to share some of your good, less good experiences and needs. So the floor is yours.
May I come in? It's Stefano.
Yes, Stefano.
Hi, thank you very much. This is an excellent presentation, and I As you were doing it, I was thinking that perhaps we should replicate it one more time, also in French, and maybe let's see if there is an opportunity to do it in Spanish as well, because it's really useful. But some more specific question. When we talk about this, it would be this convergence of efforts and achieving complementarity and synergy. Now, it would be good to have perhaps some examples of how some more tricky situations have been addressed. For example, how the IPC for acute malnutrition has been combined with the IPC for for general food security to achieve a more common understanding of the situation afterwards in the higher level analysis. So I think if we could add, share this presentation again, but add maybe at the end some links to current key documents and current relevant material available, so that people can just click on it and link, and maybe think about for the next times if we could bring in additional example like you're asking. But I think it's excellent, and I really think that we could have more value to share it more widely. And if afterwards you and Danka and you can contact me to see how best we can diffuse this type of initiatives. Thank you very much.
Yes, okay, Stefano, that's for sure. Because of time constraints, we were thinking that to put first all this a little more theoretical activities, and then for some of the following workshops to come to some precise examples. But well noted for IPC, which is also a great. I will add it in the joint activities, because this is important. There's an important work that has been done between IPC food security and IPC acute malnutrition to harmonize. And one of the interesting output from this joint work was also the famine guidelines. So I think this is very important. And just for information, we are going to do the same webinar in French this Thursday. Yes, thank you very much. Maybe some of the participants can share now some of their constraints or some good experiences. Please do not hesitate. This is not official, so please. Do not hesitate. Yes, Yara.
This is Yara. I'm just reading some of the comments in the window to the left, and we have a few questions. So we have Bismillah, who's asking if his question on social protection. This the face there is not it's an S basically, and how I mean the question is social protection one of nutrition sensitive interventions? How can you please elaborate and give a specific example, which is actually quite interesting because as Danka was saying, that a lot of those called nutrition sensitive interventions remain quite broad, and it's difficult to see the nutrition in, for example, social protection. And that's what one of the things we were saying, and one of the things the Lancet recommended, the researchers from the Lancet recommended, is to actually design those programs with a nutrition lens in mind. And basically, for example, social protection alone might not be quite useful for nutrition outcomes. But if there's a nutrition lens while designing the program, for example, including some education for mothers or head of households on good nutrition and proper nutrition, maybe the budget that is used in the family might be a little bit used differently to purchase some nutritionally how to say, food that are better for the children's nutrition, basically. So this is one way. Danka, maybe you can say more.
Well, it's mainly well, I think Lancet has been studying some of the examples, like in Brazil and in some other countries that has these large social safety net programs. But this includes, if we come up to our life, this includes a lot, all activities that might be linked with cash and voucher assistance. And this is something that we currently are working also at GNC. We have someone who joined also GNC. His name is Andre. He is going to work on specific guidance around how different social schemes, or that we call social schemes, in fact, in a normal life, but then when we talk about emergency, this comes quite much to all the cash and voucher assistance can help nutritional outcomes. So we have evidences around this, mainly when this assistance is conditioned to, for example, use a service, or to conditional voucher that would bring that will aim to have a better dietary diversity or better balanced diet. So there will be. I can share with all of you some of the articles and the documents we have on this, and I can also ask Andre to support. But this is one of the sites, and there's also one big program that has happened in Bangladesh some times ago that brought to bring the evidence that woman empowerment with microcredit to have better impact on stunting, for example, which is also an interesting evidence that might be taken into account. And this is where the link with woman empowerment comes.
Danka, I'm seeing that there are a number of participants that are writing in the chat box, but they are not speaking. Maybe can I invite some of you to speak up and say what you wrote? I don't know, Tariq, maybe you can say what you...
Hi, and colleagues. This is Tariq from Hall of Syria. Thank you for the very interesting presentation. Just to share that we are on the same line for example, the HNO for this year for Hall of Syria. We have taken into consideration the nutrition sensitive elements. So we have developed in collaboration with other sectors a nutrition sensitive HNO, including indicators from WASH, indicators from health, and indicators from food security, as well as we have done a national survey where we also had evidence on some sort of social protection threats, namely for Syria, it could be like child and early marriages. Then we moved ahead and we had the intersectoral discussion related to both physical and mental well-being, as well as protection humanitarian consequence, selecting the joint indicators. We have a meeting tomorrow actually to decide on the programmatic modalities and finalize the intersectoral indicators, as well as the geographic convergence. Also, we have identified that to address the issues of stunting and issues of acute malnutrition, we have also to speak about some of social protection activities in details, where we are linking also with education, and also we are linking with cash-based programming or voucher-based programming, to be more specific, so we can see how we can use education and also voucher-based programming to limit some of the negative coping mechanisms like early marriages or child marriages, to ensure that we are contributing to reduction of stunting, but also contributing to reduction of related child maternal morbidity and possible maternal negative outcomes. This is just in a nutshell what we are trying to do. And over back to you, Yara and Duncan.
Okay, thank you, Tariq. This is very useful. It means that it's happening, and it means also that that, as Tariq is saying, it's possible. And maybe, Tariq, we can liaise with you to get some of what you are putting together. Possibly we can maybe share it with other colleagues. It could be something that they do know. It could be also examples that they can look at. I don't know, Danka, if you want to say something. I'm also seeing that Jacinta and Sri also wrote.
Hello?
Yes.
Yeah, this is Jacinta. I just wanted to share with you the Ethiopian experience. And as I think from what is happening, we have one of the biggest social protection program in Africa, and we call it program Safety Net Program. And this actually looks mainly on food security, vulnerability in the households. So from a nutrition perspective, what we have done is advocated. We are now in the PSNP 4, we are going to PSNP 5. So the advocacy is to make sure that nutrition beneficiaries are linked to the social protection, because the classification is the household is food insecure. There are a lot of indicators that would classify them to benefit from the social protection. But for advocacy purpose, we have ensured that nutrition is included, nutrition beneficiaries. So children who are malnourished with SAM or MAM, and also the PLW. So they have been integrated, and the most important aspect of this is that when they are integrated as temporary beneficiaries, they're exempted from public works, and with that they can access health services, nutrition services, have time to take care of the children. So looking at the whole care practices for the mothers, that they dedicate time for children to be able to feed them better. And also to access, like for pregnant women, to access ANC services and other health services. So there is a very strong link, and we have a document basically pushing for the linkages with nutrition, making social protection more nutrition sensitive. And that is already happening here, and we are now working on the PSNP 5, which is clearly one component is nutrition in the social protection. So that, I think we can share the document with you, and the others can also learn from it.
Okay, excellent. Thank you, Jacinta. This is a really good example. It would be also interesting to monitor whether families are purposely keeping their children undernourished to join this social protection also program. So that could be something interesting to monitor, but definitely a very good way to integrate social protection and nutrition. Thank you so much, Jacinta. And yes, definitely share with us. We can share with the group examples. This is exactly what Stefano was talking about. We need to share more examples, and that could be a good way of doing it.
Just to bring Yara, sorry, Jacinta, thank you very much for this example, because this is a perfect example to show how we can use other delivery platform to make them nutrition sensitive and to have an impact on nutritional status. And I think this is a great example that we can document even in a case study. So maybe I can contact you after, so we can say this.
Yeah, I think it's something that I would also share with you some evaluation of the project, because not every project goes well. There are some weaknesses that has been identified, and based on that, we are now putting that lesson learned into the next phase of the PSNP. One key issue that I would pull out is the issue of targeting. That came out very strongly that when the recruitment of the PSNP happened during the beginning of the year, but as you know, the episode of SAM or MAM occurs throughout the year. So they don't get targeted. And this is a weakness that came out in the evaluation that we are now currently trying to address, to make sure that it is completely integrated. And there's another aspect of using contingency budgets for malnutrition cases. But so there's lesson learned, and I'm happy to share this information.
Perfect. Thank you very much.
Excellent. Yeah. Excellent. Thank you, Jacinta. I'm seeing that there's also Agnes who wanted to. Agnes, are you still with us? And can you say what you wrote?
Yes, thank you, Yara. Okay, this is Agnes. I'm in Niger. And I wanted to bring to everybody's attention a tool that maybe they already came across, which is the Compendium on Actions of Nutrition that was released by REACH and the UN Network for Sun maybe 2 years ago, probably 2 or 3 years ago. And this is a compendium of all interventions that relate to nutrition and how they can be more sensitive to nutrition. Some are nutrition direct too, and so it's a great tool for knowing what interventions you may develop and how to make them more sensitive. And there is also the evidence, if there is any, and the level of evidence for each intervention. So I wanted everybody maybe to access to this tool, and we can probably give a link.
Yes, thank you, Agnes. After the webinar, we are going to put together all the documents, and for sure the compendium of action done by REACH is extremely useful because it's very direct and can bring a lot of ideas. So yeah, for sure this will be part of the documents we are going to share. Thank you for the advice and thinking about.
Thank you. It's just like a dictionary, actually. You don't read it through, you just go to whatever
like catalog,
is of interest, like a catalog. Yes, exactly. Thank you.
Okay, great. And I see that there's also Bismillah. Did we answer your question? Because there's Tariq and Jacinta that spoke about social protection. Is there something you wanted to ask to the group, or just to share some experience?
Yeah, thank you. Nice to be with you. Yes, I asked about the social protection to give us about a specific example what in social protection can be a nutrition sensitive intervention for that's broadly explained there, but I would love to hear from you about that. Just a small example about the integration or convergence of health and nutrition services through use of MCH handbook, which is recently applied in specific locations of our country, and it is very much effective in not missing a child from all nutrition and health services. There were some missed opportunities in health facilities. When a child is brought for vaccination, he or she would have been missed for growth monitoring or screening. Vice versa, if he is brought for screening or growth monitoring, he would have been missed from immunization or other health services. So Ministry of Public Health, in collaboration with the UNICEF and other actors, designed a MCH handbook, which is a small booklet. It is having all needed interventions for a child from the time of, for example, conception, during ANC or antenatal care for the mother, till the child becomes 2 years old. So that is one of the examples that we can give to the floor about convergence, that how we are integrating health with nutrition services. We also have ICN, or Immunization Communication Network. They are working for polio, and they are not only used for polio, but they are also used, they are trained and they are used for nutrition, screening of children. They are detecting some cases in the community, and they are referring some cases to the health facility where they are registered and they are enrolled into the some treatment program. So just two examples from Afghanistan. Thank you. If you have any question.
Thank you, Bismillah. Thank you from Afghanistan. Yes, thank you. I think this would be an interesting booklet as well to share. And maybe I wanted to ask all of you to, if you have interesting examples from your countries, to share with us. And we definitely will share again back with the wider nutrition cluster colleagues. And I'm seeing that we are, it's the end of the hour. So I just wanted to ask if any of you had something burning that they wanted to share. I know that you probably all have another appointment afterwards, or some of you at least. I don't want to delay you. But if anyone has something burning to say, please do share with us. We can stay 3 minutes still in the call.
Yes, Yara, this is Najwa.
Yes, hi Najwa.
Hi. Yes, I would like to share an example of integration from Syria, especially in the IDP camps, where we try to integrate nutrition services such as, for example, breastfeeding counseling into GBV-related services, and vice versa. We use the mother-baby areas in order to talk about GBV. Also, we found that some of the children who develop some with complications, these children, they develop complications just because of neglect. So through our work with the protection sector, we managed to work with the mothers in order how to take care of her child, etc. So this is an example of some of the work that is going on in IDP camps. Thank you.
Yeah, thank you, Najwa. This is I think some of those examples are also seen in Bangladesh. I don't know if there's someone in Bangladesh on online, and that's quite important area again to document. So please send us whatever you can with us if you have any documents, so we can share with the rest of the community.
Yes, thank you so much, Najwa. This is really a very good example as well. So, okay, I would really love to stay and talk more. However, I know that we have set 1 hour for this call, and I would like to respect your time as well. So thank you so much for your participation. We will be sharing with you the webinar. We will be sharing with you links to additional documents. If some of you share examples, we might be able to put them on time to share with the others as well, some of the examples you share with us. I want you to know that myself and Danka are here. We are here to support you in any technical question, and even even if we don't know, we can link you up with other countries, or we can look up resources or ask other experts. So we can also brainstorm with you. So please don't hesitate. We are here to support you. And maybe Danka, do you want to say something before we end the webinar?
Yes, first I really want to thank for the participation and the interest. Well, now you know that we are, I will be absolutely available for any question you might have around this. This is something that is quite specific that I would like also to know more, but maybe in the further communication is how also different tips in the processes to work with the rest of the sector. How do you raise the attention to nutrition sensitive? I think this is something that might be interesting as a discussion. So if you have also some examples of this, please share with us. Yeah, and we are here to support. Do not hesitate to contact us.
Okay, great. Thank you, everyone. So, and we will just, how to say, have a good day, a good afternoon, a good morning, depending on where you are, and speak to you all soon. Bye-bye.
Bye.
Thank you. Bye.
Bye. Thank you. Bye-bye.
Bye.